Everyone. We're just going to wait a couple of moments just to allow everyone to log in, but thank you for your punctuality. We look forward to starting in just a moment. Okay, so to be respectful to everyone's time, I'm going to go ahead and start. I want to begin by welcoming everyone. And for those of you that have never attended before, this is our Wellness, Resilience, and Survivorship series here at Cedars Sinai Cancer. And this really started for us to have a chance outside of the clinic to take a deeper dive into a variety of topics that we think are important in the space of cancer survivorship and wellness. So in the past, we've covered wide-ranging topics from sexuality and cancer survivorship to dietary concerns and music and wellness and the experience in awe and other topics. I am really excited to introduce our truly stellar panel and guests today. We've entitled today's presentation, The Emerging Science Behind Body Composition for Patients with Cancer. And we went on to say that it's not the number on the scale that matters most. And as we'll talk about, we realize that there's been a lot of emphasis on the number on the scale and so the so-called body mass index, or BMI. And I think today's talk is really going to be important to recognize the many nuances that really go into BMI and our weight and our scale and other factors that are really worth considering, particularly through the lens of cancer survivorship. So again, I am really delighted to have an amazing panel. I'm going to start first by introducing our guest, Dr. Carla Prado. It is an honor for me to introduce her. And I know, a lot of times people hear people's bios, but I do hope you really hear this because she really is an amazing resource for us to bring to you and the expert in her field in this arena. So she is a professor and registered dietitian at the University of Alberta. She directs the Human Nutrition Research Unit, which is one of the top research and training facilities for body composition and energy metabolism assessments worldwide. Dr. Prado is an expert in assessing nutritional status with a precise measurement of body composition and energy metabolism. The focus for her current research is to investigate the prevalence and health outcomes of abnormal body composition phenotypes in patients with a variety of chronic conditions. She's also developed targeted nutritional interventions to optimize body composition and improve health outcomes. Dr. Prado obtained her PhD from the University of Alberta, and she's gone on to do more prestigious postdoctoral training in other areas such as the NIH. And she is an associate editor for the top 3 journals in her field. She's been recognized in the Canada's top 40 under 40 list, and she's been named as one of the most powerful women in Canada, top 100. So I can tell you, having had a chance to speak with her, this work truly does represent her passion, right? So this was a labor of love, and I think that's going to come through as we get a chance to talk to her. So Dr. Prado, thank you so much for joining.
Thank you so very much, Dr. Asher, for a wonderful presentation or introduction. And thank you all for joining us today. Hopefully you can see the right slides. There you go. It's truly my honor to join you. When I got this title, this award about, the top of like 100 women in Canada, I told my little daughter, she is 5 years old, and she looked at me very skeptical look, and she's like, "Mommy, you do not have superpowers. Like, who gave you this award?" And, at that time, I had just finished working all day. I was going to cook her dinner, had to give her a shower, was probably going to clean the house after that. And I'm like, Mommy is a superwoman, as I'm sure a lot of you here today are as well. But really, this is a result of many, many years of work. And I want to share a little bit of what I have been learning. And I love to learn from patients. I love to learn in opportunities like the ones we have today. So it's, again, a learning curve for all of us. So welcome to this webinar, to this discussion, and hopefully we're going to learn a little bit about body composition. So these are my disclosures related to speaking engagements and advisory board participation, but it has not influenced the content of my presentation. What I'm presenting today is related to my research, my beliefs, and I'm not presenting any products. So I'm going to get started with a question, and just for you to think about it a little bit. When we think about body composition, I am today going to be particularly focusing on muscle, and body composition refers to these different proportions of muscle and fat in our bodies. But when you think about low muscle, for example, which is a type of abnormalities in body composition, I would dare to say that most of you, when you think of someone who has low muscle mass, would probably think like of a patient or a person who is very thin and potentially frail, or an older adult. And, most people would probably say that. And for example, what I have to say is that this is not always the true. And when you put people on a scale, sometimes it's obvious that body weight cannot tell us where the proportions of muscle and fat are. So for example, this is a classic example that we know these people can have exactly the same body weight, but a person living in larger body size will have a higher proportion of fat compared to someone who is a bodybuilder who will have a higher proportion of muscle. But that's very obvious, right? We're looking at like the scale, like we're looking at this figure, we know exactly why these people have the same body weight. But what I'm going to talk about today is much more subtle. It is something that is we not necessarily understand and not necessarily think about on a daily basis. And I love to use analogies in my work, and an analogy of what I'm going to be talking about today can be done using a pomelo and an orange as an example. I'm not sure if you've seen a pomelo before. The Latinos here probably, like me, will have seen one, but the pomelo is this very large fruit, as you can see here. So compared to an orange, the pomelo is much larger. But when you peel the pomelo, the amount of fruit on the inside is actually quite small. So compared to a cross-sectional area of an orange, the pomelo has much less fruit, yet it's much bigger on the outside. And the same is true for our body composition. What's on the outside does not tell us what's on the inside. And the subtle explanations, well, every time someone comes in, I can change my slide. That's why we're seeing this noise here. But the same is true for our body composition. So here you can see examples or illustrations of very different people who all have low muscle mass, but clearly they have very different body weights. So all these individuals can have a low muscle. So at any given body weight, you can have people with low muscle mass. And in this case, you can have people living in larger body sizes who have low muscle mass, people with normal body weight who have low muscle mass, and people who have a low body weight who also have low muscle mass, which is more the classic example. And how do we then identify these abnormalities, what we call abnormalities in body composition, especially this case, for example, you can have very little muscle and a high amount of fat mass. This is hidden behind the book of body weight, because on the scale, you would think that a person who is living in larger body sizes would have more muscle. They are carrying the extra weight around, and that's actually true for many people. Because of the extra weight, we can have a little bit more muscle. But for a proportion of our population, especially patients with cancer, they can gain fat without a concurrent increase in low muscle and in muscle. And that's very important for patients. And this is what we're working on. We're working on identifying these abnormalities in body composition that are hidden. When we go to our physician's office, we're just looking at body weight, but where is this body weight coming from? And I'm going to show you that that's actually quite important, especially when you're dealing with cancer. And we're working with very sophisticated techniques. Some of these techniques are seen here. Other techniques are bedside techniques, meaning clinicians can apply, and like any patient would probably have access to that in the future. So we're working towards that, working towards using very sophisticated techniques, but also making these techniques available for everyday use so that many people can benefit from assessing their body composition. So using body composition assessment versus just looking at the scale, we can look at the inside. So we can look at inside of the body and look at these different proportions of muscle and fat and how they impact health. And as I've mentioned before, I'm particularly interested in looking at low muscle mass, whether low muscle mass occurs in people living in larger body sizes or in people who have small body weights, who are frail, or have what we call cachexia as well. Now, when we don't have access to these very sophisticated techniques, there are what we call surrogate ways that we can look at our muscles, surrogate ways that we can look at our body composition. And this can be done using anthropometrics. One of the most popular ways that we have to have an idea of our muscles is looking at calf circumference. And calf circumference is the most commonly used metric to estimate muscle mass. Again, it's not a direct measurement, it's an estimation, but that's very commonly used in clinical practice. So we call it a marker of low muscle mass. And that actually is used a lot in older adults because we lose more muscle in the legs when we are aging. So it's easier to track that over time. And as you can see, all you need is a tape and a specific way of assessing it. Now, sometimes, again, it may be complicated to assess it in people living in larger body sizes. The fat in the calf can confound this measurement. Nowadays, we have adjustment factors that we can use. I'm not going to go into details into methodology here, not to bore you, but we do have other ways that we have available in the clinical setting. But something very interesting that Japanese researchers came up to, especially that was relevant later during the COVID pandemic, was doing the assessment over the phone, and that's called the finger ring test. So for fun, if you want to do it while you're watching us, you can sit in a chair. So as you're sitting down, you're going to have your foot flat on the floor, as the image can show you here, and then you form a circle with the index and thumb fingers. So you can go all the way down and come up. So the largest portion of the calf, that's where you want to check if the calf is smaller than the circle or not. So if it's bigger, that's where you want to see. If it's just a fit, it's probably still okay, but something to watch for. But if it's smaller, that may be a suspicion of low calf circumference, and therefore low muscle mass. So again, it's a marker. It's not diagnosing anything, but a way that, especially with telehealth, that was very useful for assessing low muscle mass, especially in older adults. So again, there are surrogate ways. There are other ways that especially people can have access to, such as using those what we call the bioelectrical impedance analysis scales. We can talk a little bit more about that, how to assess your low muscle mass during the Q&A later on. So then why is that important, right? And we're going to get to that in a minute, but I just want to tell you a little bit about who is at risk. We've talked about how that's hidden. So if you have a normal body weight, it doesn't mean that you don't have low muscle mass. If you have a larger body weight, it doesn't mean that you have low muscle mass. And the same way for people who have a low body weight. But then is it more prevalent in older adults? Because as I've mentioned, we lose muscle as we age. And is that something that only people with cancer have, or older adults have, or what other conditions or situations you would expect to have low muscle mass? And this is just some examples here that I can usually ask if you're in a live audience and get some of the answers. But the answer here is, who is at highest risk for muscle loss? All of the above are correct. So as we age, we lose muscle. Cancer is a disease that we call catabolic, so it can lead to the wasting of muscles. When we are hospitalized, especially for bedridden, that can lead to substantial muscle losses. COVID-19, either people got very severe COVID-19, or if they or less or mild COVID-19, there's data that shows that that was associated with muscle wasting. And even if you didn't have severe COVID-19, we were mostly in lockdown. There's some studies showing that people were eating less healthy. So certainly this has impacted the prevalence of muscle loss among us. So any of us are at risk for muscle wasting, but especially as we are aging, but especially people who have these conditions, and cancer is one of the above here. So contrary to popular belief, it's not only the older, frail person who actually will eventually develop low muscle mass. And I think that that's obvious that, we're all losing muscle as we age. This is just an example of Arnold Schwarzenegger, but can actually prevent. There is prevent losing a muscle that will have a consequence to your health. So although we're all losing muscle and then cancer can be associated with muscle loss, there's some things that we can do to try not to cross that threshold where the loss of muscle will actually become substantial and very impactful for you, have a negative impact on your health. So to summarize, low muscle can occur at any age, so we should all be worried about it, but it's especially important for older adults, people who have 65 years of age and older. Again, any body weight, I've talked a lot about that, and in health and disease. So we've talked about the healthy aging process, how we are all losing muscle, but it's especially important when we are dealing with conditions like cancer. We have not only cancer that can lead to muscle wasting, but also cancer treatment, as I'm going to show a figure coming up soon about that. And even in addition to cancer, there are other conditions that are associated. I wanted to make this very, very relevant for everyone here, and that you can think of other relatives that may have other conditions that are leading to muscle wasting, so that you can certainly be thinking about that as a very holistic perspective, and how I really envision us thinking about muscle more often and prioritizing the study of muscle throughout, among physicians and also among researchers as well. This is the figure that I said I was going to talk a little bit about related to cancer. So as I've mentioned before, cancer itself can lead to muscle wasting. So even before cancer has been diagnosed, the tumor starts producing molecules that are going to act on muscle, leading to this muscle wasting. So we can begin losing muscle even before cancer is diagnosed. At the time of diagnosis, the tumor is more aggressive, is what we call biologically active. So it's producing more substances that can act and lead to muscle wasting. And even during cancer treatment, progressive muscle loss can occur. You may also lose fat mass as well, because we have surgery, we have chemotherapy, and those can be detrimental to muscle wasting. So the prevalence of low muscle mass increases as cancer progresses, and it can be very high during cancer treatment. So people who have cancer are at much greater risk of losing muscle, and this loss of muscle is much more accelerated compared to the amount of muscle we lose just with normal aging. And this muscle loss can be quite substantial. What I wanted to show here is just an example that, for example, an older person who is hospitalized and is at the hospital bedridden, so is in bed for about 1.5 weeks, this person can lose about 1.5 kilos of muscle mass, and just multiply that by 2.2 for the pounds. But it's substantial. Like think of a roast beef. That's how much muscle we lose if we are bedridden in the hospital. And not only older adults, it's more pronounced in older adults, but people of any age lose a lot of muscle if they're hospitalized. But would you think that it's easy to gain that muscle? Would you think you can gain the same amount of muscle if you start eating healthy and exercising? Like, you think 1.5 weeks we can build that much muscle mass? Well, the answer to that is absolutely no. It takes a way longer for us to gain the muscle that was lost over such a short period of time. Just an example of an exercise intervention study in older adults, for example, it took them 12 weeks to get about 0.6 kilos of muscle. So much less amount of muscle that was gained over 12 weeks compared to this very rapid massive amounts of muscle loss that I've mentioned before. So it takes time for us to build muscle. And that's why I like to use the analogy that losing muscle is like a wildfire. So the forest is on fire, the fire, which is, especially in the context of cancer, going to lead to muscle wasting very, very fast. And obviously, think of you rebuilding that forest, it's going to be much more difficult, right? And the same way is with muscle mass. It's difficult to gain muscle, so it's better to prevent the loss. So it's better to prevent the wildfire. And that's one of the reasons why we're talking to you today about, like, what can we be doing to avoid this muscle loss that occurs in cancer or any of the other conditions that I've mentioned before. So the secret for that is early and continuing intervention. So we need to intervene early, and it takes time. So maybe if any of you have tried a specific approach, for example, a specific diet to increase muscle before, you stick to it for 12 weeks. So you've just seen the example of that study, that it's not enough to build the amount of muscle that you lost over such a short period of time. So our interventions have to be, it takes longer. So we have to have these interventions that, first of all, prevent this loss, but also that are going to track into survivorship so that we can rebuild that muscle and prevent further losses. And again, the reason why we care, I've been talking about muscle. I promise I was going to talk a little bit about why do we care about muscle. All of us, when we think of muscle, we think of posture, balance, and what else? Mobility, right? And if you think about it, muscle is so important. Think about water bottle. If you're opening a bottle of water, you need your strength, or you can jam or whatever. You need strength to open it. If you want to stand up from your chair, you're going to be using your muscles to stand up from the chair. So muscle is very important, certainly for movement, for balance, for posture. But what very interesting, and what I want to talk about next is another function of muscle, which is what we call the functions of muscle in the body, or the metabolic functions. These are the ones I've talked to you about. We call them the structural functions. Well, strength, posture, balance, and movement. But the metabolic functions of muscle is what we are interested in learning more about, and really understanding why muscle is so important. I remember when I first started doing this research, I got a comment in one of the grant applications, and researchers leave to apply for grants so that we can do the studies we do. And someone was like, "Well, once a person has cancer, muscle is not important." And this person couldn't be more wrong, because again, muscle has so many important functions. And if people lose muscle, they not only may be losing their ability to be independent, but again, muscle has functions such as amino acid reserve. LJ is going to talk a little bit about that. So it's a reservoir of amino acids, which are the building blocks of proteins that are going to be mobilized for a lot of functions for the immune system in our body. So when we lose muscle, the immune system gets affected. It's important for glucose regulation and several other important functions, like they produce molecules that are going to be talking to other organs in our body, trying to adjust systems and making everything function properly. So in a way for us to understand, it's like the more muscle we lose, the greater the consequences for our body, and also for the ability of us to function normally. And what the literature shows us is that the greater the amount of muscle you lose, the greater the consequences. So losing about 10% of muscle is associated with impaired immunity and increased risk of infections. Losing 20% is associated with weakness and decreased healing. Losing 30% is associated with physical impairment and no wound healing. And losing 40% is associated with increased risk of death. So yes, muscle loss is associated with the ability for us to live longer. And more we have understood that, especially in the context of cancer. And this is a study that we've published back in 2018, and then Forbes magazine actually highlighted that. And we were looking at this muscle wasting that women with breast cancer presented with. So this is a large study. We followed women's survivorship in more than 3,200 women. And 34% of them presented with low muscle mass. But this is like early stage breast cancer, stages 1 and 2 breast cancer. So think of it, stage 1 and 2 breast cancer, you have surgery, you become a cancer survivor very fast. But what we found is that 34% of the average younger women had low muscle mass. And then if you had low muscle, independent of everything else that clinicians or oncologists use to predict survivorship, they were 41% more likely to die. So muscle is important, and it is important for survivorship. And this is a meta-analysis. So meta-analysis are studies that combine data from different articles in the literature. So it's a strong way of looking at why this is important. And this is what they found, is that older adults who have low muscle mass, this is a look at how increased the risk of losing muscle is. But what I want you to remember from this presentation is that the cancer, people with cancer 1.69 more times likely to, who have low muscle mass, more likely to die. And this is all the other conditions here that were associated as well. So people with these conditions who had low muscle mass, they had a greater likelihood of living short, like having a shorter lifespan. So this is very important and shows again the importance of muscle and why we're talking about here today. In cancer, the consequences of low muscle mass is not only related to survival, but as I mentioned before, physical impairment and disability. You begin losing function, so things like combing your hair, getting in and out of the car is difficult, and that can lead to the impairment and disability. It can also increase the risks of falls and fractures. If you're hospitalized, it can lead to greater lengths of hospitalization. It's difficult, the wound healing process gets affected as well. The people who have low muscle mass, they need more rehabilitation. If they are operated, they have surgery, they develop more post-operative complications, and obviously poor quality of life. If you can't function by yourself, if you're losing your independence, it's difficult for you to move around, even get up from a chair. Obviously, this affects our quality of life. And we've did a lot of research as well showing the relationship between low muscle and severe toxicity to chemotherapy treatment. So people with low muscle, they are less able to tolerate chemotherapy. So they developed what we call dose-limiting toxicity, which is unfavorable. We don't want our patients to develop that. And then now, close to finishing here, but what can be done in terms of that? I think that many people are very skeptical that, can we do anything since cancer is catabolic, surgery can lead to muscle loss, treatment can lead to muscle loss. But absolutely, yes, we can reverse age or disease. We can halt, we can stop, and can we also reverse age or disease-related muscle loss in most cases. And we can also optimize body composition. Even older adults can build muscle. That's one example there for you. And that's what we're going to be talking about the next part of our presentation. We're going to be talking about the importance of food and nutrition. And yes, exercise is key, obviously, to building muscle. Very, very important. But it's our goal today to also show you that nutrition is very, very important. We can use food and nutrition to prevent and reverse low muscle mass. And it can be prevented. And I joke that nutrition is like the ugly duckling. So we usually don't give the importance that it deserves, but it's a very important piece of the puzzle. There are several factors that are ultimately leading to muscle wasting in cancer, but nutrition or having an optimal amount of nutrients, or the quantity and the quality of nutrients, is really essential for muscle health. And that's why my dear colleague, I say that she's a trailblazing dietitian. I'm very proud to be here with her. LJ is going to talk to you about, and I'll be back soon. Thank you very much.
Thank you so much, Dr. Prado. I'm very delighted to introduce one of our own. For those of you that do not know LJ Amaral, she is a clinical nutrition coordinator in the Center for Integrated Cancer and Lifestyle at Cedars Sinai, also known as CIRCLE. She is a registered dietitian who's board certified in oncology nutrition. She completed her internship to become a registered dietitian at Memorial Sloan Kettering in New York. She has worked in cancer research at Cedars since 2015 and is currently researching the efficacy of the ketogenic diet as an adjunct to standard care for people with brain tumors. For those of you that do not know LJ, she's always the one in our audiences that asks the most inquisitive questions and thought-provoking questions. And I say that because we are going to have a Q&A moments in just a little bit after she finishes. So do save your questions, and I'll help moderate in a few moments. So LJ, thank you so much for joining us. It's all yours.
Thank you. And thank you, of course, Dr. Prado, for honoring us with your presence and your knowledge. It's just amazing to learn from you. So I'm going to come in and talk about some practical things in terms of nutrition that you can do to prevent the muscle loss that she's been describing. So I think we don't give enough importance to protein, and 9 out of 10 adults do not meet their protein needs. And it's really a ubiquitous molecule that helps to produce a lot of different types of functions and different ways that it can produce other things within our body. So especially within the context of cancer, we're really using proteins as building blocks. So when you're going through cancer treatment, whether it's chemotherapy or immunotherapy or radiation, likely your bone marrow will be affected in some way, especially if it's for a prolonged period of time. Bone marrow cells are things like red blood cells, white blood cells, and platelets, and those are essential to be rebuilt as you go along through treatment. And that really comes through our food and our energy, and really making sure that we're prioritizing protein. And I think protein can be something kind of tricky for a lot of people, because there are so many things in the media or articles that come out, or maybe some research has been digested in a way that's spit out. Like, I'm thinking of CNN, they take a lot of research and then they make a headline out of it, and that's not always accurate. So I'm just really showing that protein has a lot of different functions in the body. So not only does it help to regulate our cells and cell production, but they're involved in a lot of different cells that help secrete digestive enzymes, or help to create proteins to create new DNA or RNA strands to create new cells. They can help with our immune system with creating new antibodies and T cells. They're important regulators of hormone function, or like the hemoglobin that's listed here that carries around our oxygen throughout the blood. So they're extremely important to be ingesting, and ingesting in sufficient quantities, because it's important that we get not only enough protein, but also enough calories, so that we are creating an anabolic or a building part of metabolism. So there are different ways in which we can support our muscles. And so there are some ways in which muscles can be, it can be more fast, the degradation of muscle loss. And so just like Dr. Prado was talking about with aging, normal aging, we see a loss in muscle. As we go through menopause, or as we naturally age, we have decreases in our hormones, and that can help promote our muscle loss. If we do not eat enough, as we age, our hunger and our thirst mechanisms decline. And so even though our protein and our energy needs can sometimes stay the same, our energy, like our check engine light, so to speak, to tell us when we need to eat is not always accurate, leading to that low dietary intake, as well as being inactive or leading a sedentary lifestyle. And then, of course, inflammation. And that can happen, if you are overweight or obese, or have any autoimmune diseases, that can increase your inflammation, as well as cancer. Things on the other side of the plate that can promote muscle gain. So we try to have people follow about 25 to 30 calories per kilogram. And that's a standard that we use throughout treatment and survivorship. And so, if you're really curious about your needs, I would encourage you to work with a dietitian. In terms of protein needs, especially if we're talking about anabolism or muscle gain, we typically recommend somewhere between 1.2 and 1.5 grams of protein per kilogram body weight per day. And we'll go over examples of that as well. We want to also make sure that if you are avoiding any animal-based products, that you are getting a complete amino acid profile. That's extremely important, because there are a lot of plant-based protein sources that are not sources of complete amino acids. And we do need all of the amino acids in order to build proteins and build muscle. There are also some interesting studies looking at HMB that we'll go over, and glutamine, carnitine, and creatine are some other supplements that people will use in the bodybuilding arena. There's some really interesting research looking at fish oil or omega-3 fatty acids to help preserve muscle mass, especially in the context of cancer. There are specific vitamins and minerals, particularly vitamin D. And then, of course, just like Dr. Prado was saying, nutrition is really just one part of the pillar, and really we need to focus on more than just one. So what type of nutrition can really help? So we're talking a balanced diet. So, we do promote both animal and plant, and we can go over more of that in detail as the slides go on. So protein really coming from animal-based products, plants like soy or legumes or nuts and seeds. Vitamin D is also helpful for that muscle health. Unfortunately, we don't have a lot of vitamin D within our foods, and so most of them are fortified. And I really encourage you, if you don't follow up with your primary care doctor, please do so and ask them to pull your vitamin D. It is a really important pro-hormone as well. And I think it's really important to follow that along, at least on a yearly basis, and supplement as needed, because most of us do need a supplement. Omega-3 fatty acids, there is some really interesting research that's coming out that it could play a role in muscle preservation. And omega-3 fatty acids, really focusing on the ones that are coming from the animal-based products. So that's looking at mostly the cold water fatty fish that are listed here. And I say animal versus the plant sources because animal sources are converted more readily to the omega-3 that is used in the body. Plant-based sources have a very low conversion rate, and we don't absorb most of the omega-3 that they have. With HMB, or hydroxymethylbutyrate, that is a byproduct of amino acid metabolism. And there have been some studies, especially when I started out in the field 10 years ago, there used to be boost products or Ensure products with HMB to help with muscle preservation, because there are such small quantities that we find in our foods naturally occurring in things like catfish or avocados or cauliflower. And to really have an effect on muscle growth and anabolism, you would have to be getting at least 3 grams per day. And so that would have to come from a supplement. And of course, if you were to try a supplement, make sure that you're talking to your provider before starting one. So in terms of protein sources, what are good protein sources? I will say animal-based sources have the highest amount of grams of protein per ounce. And so if you're looking for a bang for your buck, so to speak, if you're not eating a large amount of volume, a piece of red meat, poultry, or fish will have a lot more grams of protein per ounce versus a plant-based source. Eggs are a wonderful source of a high biological value protein. So they're a great source of protein, especially on the go, and same with dairy. In terms of the plant-based sources, so pulses like nuts and seeds that are listed here, or lentils or beans, chickpeas, soy foods, and then of course being mindful that not all plant sources are created equal. So soy foods, chickpeas, spirulina, those are examples of plant-based foods that do have a complete amino acid profile, but not all do. So just like we had been talking about in terms of complete proteins, so soy-based products are complete protein. Gelatin, even though it is considered an animal-based protein, it doesn't have tryptophan, so it would not be considered a complete protein source. Same thing with collagen. I know a lot of people like to take the collagen protein peptides, and that's perfectly fine, but that I would not consider to be a sole protein source or something that I would use as a complete protein. So incomplete proteins have one or more missing amino acids. So things like vegetables, cereals, grain products, and legumes, they are missing one or more of those amino acids. And so you can either pair these foods with other foods that do have a complete source of amino acid profiles, or choose to consume some animal-based products as well. In terms of red meat, just because I do think that this is something that comes up very frequently, especially in the 10 years that I've been in clinic, red meat and processed meat, we know the judge and the jury are out. We want you to try and limit and avoid red processed meats, right? So those are things like hot dogs, deli meats, prosciutto. Those are the foods, bacon, that we know for a fact can increase your risk for carcinogenesis. But then we have this whole thing where mass media, maybe certain studies, lump all red meat together in one umbrella term, and that's not always helpful because that's classifying all red meat as being bad and harmful. And frankly, we're not at a place, I think, that we can say that when we have new sources of red meat that have come out, right? Where we have different nutrient profiles for grass-fed versus grain-fed. And maybe the way that you cook it can make a huge difference, right? So if you're putting this like over a hot grill with open flame, then that would increase your risk for carcinogenesis. But let's say you have grass-fed meat in a stew that's been in a low heat cooking with no direct heat. I think that we need to be doing better and bigger research studies to look at the effects on that and cancer. Also, looking at red meat is talking about avoiding its intake for cancer prevention and not necessarily for avoiding it in terms of cancer treatment. So I have a lot of patients who end up telling me that when they are going through cancer treatment, that they have these intense cravings for red meat. And then you look at their chart and their hemoglobin is low. And I think it's really interesting, your body is telling you what it needs. And, red meat has an amazing source of heme iron, which can replenish your hemoglobin. So I do think that there's a lot more that needs to be done in the arena of red meat. And we shouldn't be in a place where we're putting it all together in one category and demonizing it. So in terms of looking at plant versus animal-based proteins, this is a slide from Dr. Catherine Ford, which was Dr. Prado's student. Most of these slides are also courtesy of her, which is amazing. She's also a dietitian, and she's looked at plant versus animal-based proteins. And as you can see on the left-hand side, there are differences in both in terms of there are some favorable ways in which plant protein can work for us, and also there are ways in which it's not necessarily the best choice in certain situations. So I always get patients telling me that they want to eat a lot of spinach if they are anemic, and there are also a lot of different competing nutrients within spinach that compete for the same absorption of iron. So you can see here, iron is typically low. So, everything comes, of course, it's not a perfect science. And I'm not saying, of course, that you have to be eating animal-based proteins in order to be healthy or maintain your nutritional status. But there are a lot of benefits to eating animal-based protein, especially in terms of preserving your lean muscle mass and increasing the amount of cells that you're producing. In terms of the recommended protein intake for you to follow at home, we typically recommend in treatment, if you're in a catabolic state and you've also lost weight, as well as ESPN, which is one of the leading nutrition academies that put out recommendations for nutrition. In terms of muscle preservation and growth, they recommend 1.5 grams of protein per kilogram per day. So for the example here, if a person is 157 pounds, that's 7.13 kilos. So 157 divided by 2.2 to get 71.3. 71.3 times 1.5, that is 107 grams of protein per day. And so for a lot of people, I think women especially, it can be really difficult to meet these needs. And so you may need to be eating a little bit more frequently in order to meet this 107 grams of protein. Also, again, if we're just plant-based alone, I think it's extremely difficult to meet 107 grams of protein through plants alone, and would likely require some sort of supplementation with a protein powder, perhaps. And then this is also just to kind of play off of what Carla was saying. We've got, the stick house, we've got the wood house, and then we've got the brick house. And it can't just be one element that we're focusing on if we really want to build a strong foundation and preserve our muscle mass to go into healthy aging and healthy outcomes for cancer. And it really has to be a multimodal approach, combining not only nutritional support, but also exercise and potentially other pharmacological interventions as needed.
Okay, LJ, thank you very much. Dr. Prado, again, thank you very much. Just to go over a couple of housekeeping matters. In a moment, we're going to stop the recording, and that way people can ask questions. Just to keep things organized, because I'm grateful to have a fairly large audience today. I'm going to ask everyone to use the raise your hand feature so we can go through questions sequentially. And I'll also try to moderate questions in the chat.